see board member Merritt's on the other side now joining,
Okay.
but I don't see other board members yet on the attendee side.
Okay, and it looks like we pulled Ben over onto this.
Excellent.
Okay, perfect. So it's 3:06. We'll begin our meeting of the System Planning Subcommittee of the Implementation Board. Our first, let's do the, well, first of all, welcome to everyone who is here and joining us again for this discussion. It's very important. And what we will do first is just get settled in and do a quick roll call of the board members who are here, and we will note when others join us.
Starting with roll call, board member Reddy,
Present.
board member Merritt's,
Here.
board member Brandon, board member
Yeah,
here.
go ahead. Okay, there she is.
Perfect. And board member Chelman.
And I am here as well. Okay, so we have four board members. Hopefully we'll be joined by a couple of more people. As we do with all of our meetings, we acknowledge that King County is located on the unceded traditional land of the Coast Salish peoples. We honor this land and its people, past and present, and we are an organization that is committed to directing funding and resources to organizations led by and in support of Native and Indigenous people. That gets us grounded in where we are and who we are as a committee. We're going to get a general update at this point. So Alexis, I'm going to turn that over to you. This is kind of a where we are and how, and then we will also have today a discussion about how metrics have been redone for the upcoming second edition of the report, and then a discussion about a timeline for the draft plan and the rollout, which will of course come before us at, I want to say April 12th. Do I have the right date? Is that the meeting? April?
Yes, your meeting is on the 12th, I believe.
Yeah. Okay. So let's go ahead and begin with that. Yes, it is on the 12th. Let's begin with that update then.
Good afternoon, everybody. Thanks for tuning in. I'm going to share my screen and get us going just with some general updates. The first of which being I wanted to notify board members that we did receive a comment letter from the city of Sammamish, and we'll be sure to post that along with the materials for today's meeting. So just wanted to provide that quick update that we continue to receive comment from our public partners and adjust and incorporate accordingly and as timeline permits as we drive towards really creating a new draft of the plan. And so the other update here is the team has been working quite expeditiously to get that draft ready to go so we can have that out in the public and for your consideration as soon as possible. So that has been a lot of the focus, frankly, of this week, and will be for the next week. I wanted to provide a couple of general updates related to how we continue to refine the restructured version. I know for the past couple of weeks, we've been discussing a restructured version, which really is a much more focused look at the 5-year plan and the activities embedded within it. And so it's much more focused and driven towards what are the activities we're taking up in years 1 and 2 of the plan versus the later years of the plan, and some with a keen eye also on funding. But I wanted to bring forward a couple of general updates on how we're continuing to incorporate feedback as we have conversations with partners. So refining that restructure, some of the refinements that we're really focusing on is refining into even just grounding us in one overarching goal, which is ultimately bring unsheltered people inside quickly. And so lifting up some of the 8 goals language, but rather just refining and having us be focused on a singular overarching goal of this plan to bring as many people inside quickly over the next 5 years. You will see those refinements then reflected in the metrics to be really focused on housing people in the system and having a keener eye on system performance. And then further looking at how we're prioritizing and sequencing activities as organized by how our current budget allows. And so bringing forward a kind of revised outline of what the plan's shaping up to look like. So this is what you would see in your table of contents and how it's shaping up at this moment. A section on, of course, our mission and acknowledgements. We want to spend some time also acknowledging the many people that have been working on this plan with us, alongside us, and how this plan is built on many previous efforts to address homelessness in this region. And so wanting to spend time first grounding in that, having then the executive summary section, really keeping that at maximum 2 pages, really like what is the key thing that is this plan is driving towards. Then following section is around scope and scale of the challenge of homelessness. And this is the section that we've talked a little bit about around the enumeration methods and also what we currently see across our unhoused neighbors. And then looking at current state of those 3 levels that we've talked a little bit about, and I'll provide some updates at just fleshing out further what you can expect to see in those sections. And then the statement around our vision for future system. The 6th section is really that how we get there section. And those are the tables that we've talked a little bit about and have some adjustments to share with you all about how those tables will be reflective and tied to the overall metrics associated in the plan. And then the funding transformation section focused on our current budget, then payment reform, and then our go-for strategies for new funding. So what activities will we be taking up should new funding become available? And then a series of appendices that are meant to serve as supporting documents and all the, to really ground the plan in all of the research that had been conducted and pulled together in the initial draft, wanting to maintain those in the document, but put them appropriately to be kind of reference material to bolster and support what we are proposing across the plan. And so that's a overview of kind of the outline of the restructure. When we go into, I wanted to focus in a little bit on the scope and scale of issue section. So as I mentioned, this will include the content related to methods to enumerate and ways to count homelessness, really diving into like how many people need a safe place to live right now in King County. We're also including information here around understanding who is experiencing homelessness. So bringing forward data related to racial disproportionality and also how various subpopulations and other identities disproportionately experience homelessness. We'll have a limitation section and full acknowledgement that we know with any data set there are limitations, but we also thought it was critically important to really ground us in our work in memoriam and the lives that have been lost over the past year to those who have been unsheltered. And with that, our following section is around current state. So focusing in on individual service provider organizations. When we look at current state, we're writing up elements related to staffing and wages, data and reporting, funding, training, increased acuity level, and overdose deaths. In the section related to our network of homelessness services, we're talking a bit around data sharing between providers, referral pathways, our sub-regional gaps and subpopulation gaps, but also including some content here about how our current programs are faring. So akin to your budget presentation, both in May and December of last year, there was some content related to kind of system performance for temporary sheltering and housing options, looking at things such as exits to permanent housing and rates of return to homelessness. So including a kind of look at how our current programs are doing in the system, and also just broadly also laying out how the system operates as it stands. What are the connections between our services? This was some feedback we got from some of our partners, just really laying out how does our current system operate in terms of like the programs that we do have and what's the interplay between those programs. And so wanting to flesh that out in a clear, concise way, and sort of have that also be kind of grounding into this is our current state and what's the future state we're working towards. And the following section, when we're looking at system to system connections, we have looking at the ways in which collaboration and alignment could be improved, that limited connective tissue between systems, so folks that are the missed opportunities or folks falling through the cracks, data sharing and transparency, while also looking at accountability and role clarity, and then coordination around funding sources and how we can do more strategic investments. And so those are the type of content we're incorporating into now these current state sections on these 3 levels. And again, to bring forward this handy slide around the ideal system state that we're working towards, we have kind of ideal states for each of these 3 levels that we want to articulate in the plan. And so how we get there, again, looking at key programmatic initiatives and then this fundamental funding strategy shift. I'll be going a little bit more into these in a second, but that's a little bit about some of the refinements that we're doing, and just want to provide some more detail on what you can expect to see in the draft plan. I want to pause here before I'm talking about some of the changes around metrics. Are there any questions about what I just walked through?
Oh, I just wanted to mention Paula looks like she's trying to get over.
Oh, yes.
Great. You mentioned in the current state, like when you're talking about referral pathways, so that'll explicitly include like coordinated entry and kind of how that stands now. Okay.
Yes.
Thanks.
Yes. And I think that was some feedback from a number of partners wanting to better understand how is our current operating of coordinated entry, how is it functioning, and what are the kind of changes and improvements that need to happen to support better functionality.
Alexis, this has been, I think this is really great. And I really love the singular goal. I think that will really help us keep the plan focused and keep the organization focused. And, that doesn't need, there's obviously like lots more to do beyond that goal, but that'll allow us to pick a place to start. And but once we've got that, we can do a lot more from on top of it. Can you talk a little bit about how you're seeing the sizing of the sizing of everything? So like starting with how many people do we have to bring inside, but also this, and like how we're going to measure targets against that, and also like just the budgeting. You talked a little bit about the aspirational budgets versus the kind of pragmatic ones. Like where are we falling on those spectrums? I guess that's 2 different questions, but I'll leave those there.
Perfect. And I can speak to those 2 questions. The first one being, I'll speak to first the budget piece. Might be helpful. I know I've put together some slides on this and we can circle back on that, but we are restructuring our activities to be focused on kind of 2 tables. The first table, keeping that table focused on year 1, but keeping that within the parameters of our current budget. So what are the activities in the plan that we can make, that we would be moving forward on, keeping in mind our current budget? Similarly, that next table related to activities we'd be taking up in the future years of the plan, also keeping those within the realm of this is the current budget or the projected budget we'd be working within for years 3 through 5, considering there were no major increases. And then having a separate pullout table with the activities in the plan that do not currently have a fund source that would support them, but things that we would be putting forward first to be able to fund should new funding become available. So we're trying to really clearly delineate what's within our budget right now and what's the organization, like the prioritization, and then identifying these are things that we do not currently have budget to be able to do, but they are things that we would be prioritizing should new funding become available. And to be very clear also to the public, these tables include all of the initiatives that have been under consideration for the past month or so. They're just now organized into tables that take into account current funding, projected, future years budget funding, if there was no major increase, and then being very clear of initiatives that would involve increased investment. Does that make sense, board member?
It does to me, Ben. Go ahead. Yeah.
Yes, I think it does. I mean, starting with this year's budget as a starting point makes a ton of sense.
And just for the record, IB members Juanita Spotted Elk and Paula Carvalho have joined us now. So who else has questions regarding the presentation that we just had? or even a comment. Doesn't have to be a question. Well, I'll simply, I'll state I do like the concise theme of what it is we're supposed to be doing. I think that that really gets to the core of our job. In the plan that had been released earlier, there were a lot of elements that would be done by other agencies. And so I'm wondering how we are working on what is the funding for the Regional Homeless Authority and the programs it's going to be working on, and say increases in behavioral health, in housing, those sorts of things that may not be related directly to getting people off of the street.
Thank you for that question. You'll see in the initiatives right now on the plan, a lot of the language related to our work with our other system partners. We've really tried to clarify our lane and use language such as partner with behavioral health, partner with healthcare, partner with school systems. So knowing that our role is to come to existing tables where these conversations may be happening, or help convene tables, and want to highlight, some of the work that we served as a convener with public health to put together an overdose prevention roundtable that included system partners from public safety to fire to healthcare and so on recently. And so we've tried to make sure that our lane when it comes to other system work is along the lines of partnering and helping convene some spaces. We're hoping to take up in these sub-regional implementation plans the kind of tactical piece of who are our partners and what are they also bringing to the table when it comes to addressing things in a very localized sense. And so we're hoping to really get more concrete, and that's kind of the work of the team that's represented here, is really getting clear as we now have this plan saying these are things that KCRHA is going to be working on year 1, years 3 through 5, and working on having really focused conversations over the next few months post plan approval around what does it mean to do this work in East King County, for example, and who are our healthcare partners in East King County that need to be working alongside us. What are the programmatic shifts or things that we can do together in order to actualize elements of this plan? So hoping that this sets the stage to be having those really tactical conversations.
Okay, Okisha, Juanita, and Paula, do you have anything that you'd like to weigh in with here before we move to the next item? Okay. I am hearing none at the moment, so we are now back on time, actually 30 seconds ahead. So let's keep moving on to, if you're finished with the general update, we're going to move to metrics and measurements now.
Sounds good.
Perfect.
And I see board member Spotted Elk's comment in the chat around missing the presentation. We'll make sure you get materials on this. Really, we just walked through a kind of outline and structure of what we're looking at. So can make sure, and happy to connect as well to talk it through.
Perfect.
Wonderful.
Alexis, I just want to share, I really like the organizational clarity. I think it's, yeah, I just like the way that this is organized, and I'm looking forward to diving into the details.
Thank you so much. I want to actually really shout out the team and the staff here who have been a big part of really wrestling with what's the best way to clearly organize all of these really ambitious and important initiatives that need to be taken up over the next 5 years. So fully shouting out the team on the call today. So going into metrics, had some time to sit and work with our folks on the data team, our community impact team, to be working on this. And what we've landed on is really taking into account, we've heard a lot of feedback that the metrics in the previous version of the plan were not clear on how they were fully tying together to address our overall intention to be working towards decreasing unsheltered homelessness. And so we're moving things around so there's a clear line of logic around how the activities in the plan ultimately work towards the goal of decreasing unsheltered homelessness. So just to focus in the metrics in the previous version of the plan, there was a metric tied to each of the 70 something initiatives. Instead, we are now moving in an updated draft to have metrics that measure our progress in addressing unsheltered homelessness for single adults, families with children, and youth and young adults. And we'll focus in on what are kind of the metrics we're considering on those areas, but having high level metrics that really focus on our progress addressing unsheltered homelessness for these three key subpopulations, or pardon me, three key populations within our unhoused community. Further, the previous version of the plan had metrics focused on just really the metrics were more so progress metrics on how we were implementing initiatives. In an updated draft, you'll be seeing how each activity includes an impact explanation on how this works towards addressing high level metrics. If you'll pause, we'll walk through a couple of examples around what we mean, but the main takeaway here is that we've adjusted the metrics to be focused on our progress in addressing unsheltered homelessness, and we're drawing a clearer line of logic between how each activity in this plan works towards achieving that ultimate goal of addressing unsheltered homelessness. I want to also voice that each metric that we're talking about here will be broken down into race, ethnicity, and gender, so ensuring that we are keeping that level of analysis as well. So I have some examples to talk about today. So when we look at example metrics related to families with children, we'd be looking at things such as our number of families with children accessing the homelessness service system by program type, length of stay of families with children in temporary housing locations, number of families with children exiting to permanent housing, and the number of families with children returning to homelessness after 6, 12, and 24 months. These are some draft metrics we're considering at this point. And this would be then translated when we look at some of our key actions. These are some of the key actions that work towards addressing family homelessness. And so you can see here, for example, when we have our action related to coordinating across providers and systems to provide long-term care for families transitioning from homelessness to permanent housing, the impact of that, you can see this statement here saying how greater support to families with children transitioning to permanent housing should allow for fewer rates of return to homelessness. So that ties very clearly to this high-level metric around rate of return to homelessness.
Could you do me one favor? Could you go back one slide? I wanted to see I didn't get through the last bullet, so I wanted to see that. There we go.
So that last bullet
Permanent,
speaks to,
okay.
Yes,
Yeah.
rates of return to homelessness.
Okay, so it'll speak to, okay, so is it going both ways? In other words, the number of families with children exiting into permanent housing, and that will be an X number, but those who would return to homelessness, it would be estimated that it would be the number Y. I'm just having a little trouble with that. And it may be, yeah.
Sorry, go ahead.
No, it may be that I'm just not able to read this because one of the boxes is covered.
Oh dear, I'm sorry if there's a
no, that's on my side. On my side.
Gotcha. So I can talk a little bit about what we mean when we say rate of return to homelessness. This is something that we track in HMIS as we have client level information. So this is something when somebody may exit into permanent housing, but if they pop up again in the system, that is something that pops up within HMIS. And so being able to evaluate rates of return to homelessness at these three key timeline benchmarks.
Perfect. And I apologize. I was reading two bullets as one bullet, and that was what was throwing me off. So this makes perfect sense. Thank you all.
Alexis or John, sorry.
Yeah, go ahead.
The only thing this is great. The only thing I think might be missing from here is the diversion metrics, which you can maybe get there between like the people accessing it and then people moving to temporary housing. But I do think that strengthening and I know the term diversion has a very specific meaning, but basically making sure that we can keep people housed I think is an important part of our function. So there might be some measure at this top level on that. You know, how many people who access our services were we able to help and keep them in their current housing without having to actually move into temporary or permanent housing.
That's helpful. I can definitely take that back to the community impact team. I think to this end, and this has to do with our role as an agency and what data we're able to look at, knowing that KCRHA isn't fully in the lane of prevention per se, but we do have the diversion specific program, and we could look at programmatic outcomes to be able to, within that very specific program type, to be able to evaluate success in how we're successfully diverting people from the system.
And in the chat, Juanita had a statement. I don't know if you want to chime in here, Juanita.
Oh, is the DV part of the in the HMIS system?
That's a great question. And the answer is no, because there's actually a separate data system that speaks to specifically survivors of domestic violence. And this is really having to do with the fact that there's increased need for confidentiality to ensure protection for survivors. So this is something that is critical in our system. The Coalition Ending Gender-Based Violence supports and the coordination between service providers that provide DV services, but this does just tactically as staff prove some challenges when we're coordinating between systems, but a large reason for having different systems is to support the confidentiality of survivors.
And then I have another question too, because we're talking about children and families being homeless. So the McKinney-Vento with the school systems, are they included in the system metrics?
So we have, not within metrics, we do have some activities related to how we work with McKinney-Vento context, and something that family service providers have really elevated is the importance to be supporting a coordination with school districts. So we have activities related to that coordination and improving that coordination, but that under this revision of the metrics, that's not a clear, like, high-level metric.
Okay, well, I was just trying to get a better understanding about the HMIS, because we include families. Would that also be DSHS putting their data in that system? Or just coordinated entry, put them in that system? Sorry.
No. Can definitely bring in our community impact team to talk more about specifically what's in HMIS, but to my understanding, HMIS is exclusively our service providers, so local emergency shelter, transitional housing program service providers use the system. But what you're speaking to is the fact that we have other data systems that evaluate and support people, and having that connection between those data systems is something that we're trying to really work on improving. Does that answer your question, board member?
Yeah, thank you so much. I understand it better now. Thank you.
Yeah, I think that connection to the schools, both K through 12 and maybe even community college, somehow being able to coordinate and be able to share some data that way is really important. Others with comments or questions? Ben, I may have interrupted you with a second question.
No, I don't have any comment. I don't have any questions. I think I forgot to say how much I love these simple metrics and how I think this is really going to help create clarity and accountability. So I thank you for this.
Excellent. Any other? Okay, I jumped you back a slide. Let's move forward.
Okay. Thank you. So what I was just talking through a little bit here is how this table would resemble what you would see in the plan in terms of here's the activity, here's if there's any funding implication, this part is going to really change. But the key piece I want to elevate here is around just being very clear around the impact and why we're putting forward these activities and how they work towards addressing and really improving the outline metrics that we just walked through. So having a series of metrics along those lines, and then talking about how each of the proposed activities ultimately work towards and impact and will support our progress in improving the metrics on those areas, such as rates of return to homelessness, such as length of stay, and such as exits to permanent housing. And that's kind of the main gist of what we're looking at with adjusting the metrics in the plan. So a bit of a big pivot. Again, we were talking about having 70 something measures that we'd be evaluating to really getting and adjusting them to getting clear on addressing unsheltered homelessness in our progress. With that, that's the metrics update. I can talk a little bit about prioritization of activities, but if there's any questions, comments, or concerns on metrics, if not, I can keep us rolling to
go ahead. Let's just make a quick pause, and are there any more questions or comments on the metrics? It looks like it's going in a direction that at least several board members have been asking for, and I think this is going to provide a lot more clarity. So I'm happy with the way this is working. Let's continue.
Taking us to the next area around prioritization of activities. I referenced this earlier with board member Emeritus' comment, but I just want to be clear that in this plan, you'll be seeing 3 primary big tables. The first of which being that table that outlines the activities within the first year or so of the plan that are with keeping in mind of within our current budget. Similarly, years 3 through 5 of the plan, activities that we'd be taking up that also are within current budget constraints. So assuming that there's no dramatic increase, what would we be taking up across those years? And then the following section under Go First Strategies for New Funding. So that section related to existing budget and the Medicaid transformation work that we'd be looking at. There's where you'd see a table related to activities that might require new funding. So the things that would be taking up, but definitely would require increased investment. So wanted to bring that forward as another item today that we're, again, this is responsive to the widespread feedback around wanting to understand what are things that a sort of prioritization of the work that we'd be doing, and what can we do with our existing budget, and what would we be taking up should new funding become available. So having that clearer delineation is something that we've been focused on addressing in a restructured version of the plan. Any questions on this piece?
So just if there is there anyone who, I've got a couple of quick questions, but I wanted to let others have a chance. Okay, I will just jump in and go ahead. It's on the last one, the Go First Strategies, and you mentioned Medicaid. Now that would be something that, because it's federally funded, it's a specific program, you'd be limited to use that money in the way that the program works, correct?
Yes, apologies.
Yeah,
I want to apologies. I wanted to take a moment just to clarify what I intended by that. This table around activities that will require new funding is going to be alongside and like next to the section related to Medicaid. So just want to.
Oh, okay.
Yeah.
Okay, so it's sort of the issue of, we can do things if we get funding. The funding source often requires us to work in a particular area. And there may be, new funding source that would be just what I would call a general fund type. And so I'm just wondering, as you look at what is the strategies for new funding, how do you that delineate what we always called in government the color of money? In other words, you can only use it, the money is limited to using it for certain things.
Thank you for clarifying that question. Absolutely. And so you'll see in the initiatives in the plan, we talk a lot about going for, there's some initiatives around exploring state level opportunities. And we can see this year as a recent example with, being able to leverage and tap into state right-of-way funds to be able to do a specific line of work, but those have a very narrow use. And then to your point around Medicaid billing, that can pay for a certain, the services associated with tenancy supports, for example. And so there's some initial analysis that we can be doing to evaluate what kind of fund sources exist out there and what they might be able to pay for. I think it's a matter of, is that a level of identification the board would like to see in the plan at this stage, knowing that there's a number of unknowns. As we know, sometimes opportunities can pop up to be responsive to current events. Is that something the board is interested in, or how does that strike you all?
Okay, others with the comment, go ahead, Simha.
Kind of in response to that, I think specifically around, I think one of our biggest potential funding sources is Medicaid. And I think we have a decent amount of information right now in terms of like the types of services that we could potentially provide. I think there are still some open questions and like what it would take to ensure that our service providers can like access those funds well. But in general, it should cover a lot of the types of, case management type services that we really need and that are already being done. And I think being able to just say that in the plan, like, our expectation is that this will be able to cover case management, this amount of case management, which will free up this amount of local money for building stuff. Because that's what I really am hoping we can get to, right? Where Medicaid helps us pay for services and we can use our local money to build things for the people who need it. So the short answer is yes, I would love to have at least a little bit of information in the plan about is Medicaid likely to be able to, the likelihood of Medicaid to be able to cover the types of services we have now, I guess. Sorry, I'm not super articulate today.
May I react to that? Or let's go ahead if you want to answer.
I was just going to concur. Yes, we can ensure that information is added. That speaks to that kind of trajectory change.
Yeah, so, I mean, I would not be comfortable counting on any Medicaid here, and that's largely because I asked Debbie in our last meeting, who I believe is the foremost expert on this, whether we should include that in our plan, and she said no, we shouldn't. Since then, I've had some conversations with service providers who are currently using Medicare reimbursement, and they say that it is roughly break even for them, given the cost, what they're able to get reimbursed, and the cost of administering the program. And thirdly, the kinds of things that are funded by Medicare are going to generally be more long-term tenancy supports, which I think over time is not really in scope for us, and is more of a permanent housing type of a situation. Now, I know that we do administer the contracts for the services in PSH and permanent supportive housing, but given that the goal of this plan is to bring people inside, and the way we talk about our organization is really around the emergency room, I think over time we may not even want to be in the business of permanent housing, and rather that should be somebody else completely who's doing it. Our job is to get people in from outside. So to the extent that we want to, I just don't even know we need to bring this into the plan at all. To the extent that we want to keep things focused and keep the scope tight, Medicare seems like something that could be a distraction in this plan. And I'm saying that based largely on the meeting that we had last week with Debbie and the conversations that I've had with service providers.
Other comments? Go ahead.
Like I said, just sort of respond. Ben, I think I disagree with you on this one. I think Medicaid and foundational community supports offers actually a very significant opportunity for us. And at least my interpretation of Debbie's response to your question, which is an outstanding one, right? Like, how much can we count on this? Was she wasn't totally sure. She wasn't, is this a slam dunk? She said no. But she said it was sort of in the middle, like that there is a lot of potential here. That's how I took it. And I think, yeah, I think this is a huge opportunity for us. And I think to not include this as part of I think finding new funding strategies is part of our job. And if this is has significant potential, then we need to include it.
Others on this? Would you
This
like-
is Juanita. I didn't get to hear the whole thing, but I know that there's a wide range of funding through Medicaid, and I heard with the healthcare with their new changes that they were doing, and so I think we should be open to that and pursue it, and maybe even have somebody from the healthcare authority to invite them in to this conversation. And building partnership is good, and being with my lived experience being a single mom and having really no support, kind of limited. And with my children, my daughter was in the Seattle Children's Hospital. They really never offered us anything, and I was facing eviction, and it was just really horrible. We weren't able to get an extension, and I did receive some support from, Mother Nation, which was a blessing, and it was really limited. So I know that they were talking about at another table and implementing changes to offer support, especially with families, and being able to make sure I'm not muted.
You're good.
But anyway, to be able to have a resource for families in that time, in my circumstances, would really made a difference and probably kept my children together. And in that DV situation, it would have been really helpful, and not to add to the homelessness crisis that we're facing today. And I would also like to see prevention, in additional time, especially if they are in shelters, having mental health crisis. And I think it would be just to find every opportunity, like Simba was saying, to increase the funding opportunity. So I don't think it would be hurt to check into it, because I know there was more off that they offered the Medicaid people and making it equitable. And there's also opportunity there for families that are employed. And I don't know all the details about that. And people who are getting out of treatment, instead of having to go back to the streets and relapse, right? We can also be doing prevention relapse too, because people that are coming out of those spaces, like a treatment program out, they work so hard just to get to that place and to find some way to support them. And whether it's a motel voucher or tiny house or somewhere safe, would be preferably, and I just want to voice that because I've been there myself. And to find shelter with children there's always big wait lists, and and my experience, just that drive, no matter what, I'm going to stay sober because my kids need a sober mom. We really need to support people in their recoveries, whether it's mental health, alcohol, drug addiction, and just be able to find more places to bridge those gaps and really build community and collaboration, I think is essential in these times. And so to continue those conversations and reaching out to people, because, this is our work, is life-saving work. We save lives. And so that's what we're trying to create, those bridges. And so people aren't marginalized, and with disability, that's high up there too, not only just racism, but people that are the hospital, where do they go? And who's going to be there to help them? Anyway, that's enough. Thank you.
Thank you. Other comments?
I asked
Yeah,
a question.
Of course, Ben.
So thank you, Juanita, for that. I what I hear you saying is that we need to try and get all the support that we can get, which I think is totally right. Maybe Alexis, can you maybe just, because I think this is an important question, because it really comes down to this this ongoing debate that Simon and I have been having around, like, do we want to be aspirational and assume the best, or do we want to be pessimistic and assume that we get what we have, right? So can you maybe help us square that circle by explaining a little bit more how something like Medicare FCS would fit into the plan? Like, just maybe if you explain that to us, you've already kind of figured out how to thread this needle here, and we can all just move on. But I'd like to maybe understand that a little bit better.
Thank you for that. I see there's a comment in the chat around, how we pursue Medicaid funding opportunities. I think that speaks to the kind of level that we're talking about. And I think the work that CSH has done in identifying the challenges in the implementation for service providers to do this kind of billing has been really helpful. And so an activity around this would really be around a large scale capacity building initiative, understanding like if there would be some front end investment needed to really innovate and update the system. And so supporting service providers to be able to do this kind of billing with the hope that we'd be able to better leverage long-term this fund source. And so to that end, yeah, exploring our options while looking at how we can identify some perhaps partner level investment into doing this type of capacity building initiative, again, with eyes towards the future around what it would mean to transform the payment billing structure of this system.
Okay, that makes a ton of sense. I mean, that's obviously, if we think there's potential there, we should explore it. But are there going to be, my understanding of FCS from Debbie was that it's going to reduce the burden on the local government for PSH services, on the order of like 30 or 40%, right? So you can, for the same budget that we get from the city of Seattle or the county to fund PSH, we can provide services to that many more people. So I guess the real question is, in our forecasts, when we talk about how many people we can help through PSH, are we going to assume the current cost per person, or are we going to assume the FCS funded portion and thus a reduced cost to us per person? Does that make sense? Like, is this? Are we including FCS in our cost forecast or not? That's the real question. I'm totally supportive of pursuing it, and we can have an initiative to pursue it. I'm not supportive of assuming that we're going to get it when we do our budget forecasts.
Yeah. Right now our budget forecast, to my understanding, we're not assuming under that assumption. Again, we're trying to be conservative in how we project the future, knowing that there would need to be some, again, real work done to be able to identify and get the system up to speed to be able to do this type of work.
I think the thing I really like about this approach that you've been taking, Alexis, is that I think it speaks to both Ben and my concern, at least as I see it. It's both pessimistic in that it says, here's what we do over these next 5 years with the budget we have, with the resources we have. But at the same time, it also describes like the full scope of the issue and says, if we were able to get additional funds, not just funds in general, but if we were able to increase our funds through this kind of specific mechanism, here's what more we can do. And I like that approach, right? Like, because the cost of getting those Medicaid funds isn't totally free, right? Like, there is some cost to start up for sure. And like, I would favor being straight, as much as we can. If we know what that's going to look like, here's how much it's going to cost to go get that money. Here's what it's going to, and here's what we can do with here's the amount of money we expect potentially, right? And we can't be certain of it, and we're not banking on it, I don't think, at least in the way that you're framing this 5-year plan. Okay, it's, if we get it, here's what else we can do. Okay.
So if I could, sometimes we get into these questions of, should KCRHA be the one that goes after these funds, or should it be somebody else, another agency or some sort of coordination that goes after the funds that we help? But if those funds become available either through KCRHA or through the county or someone else, what does that do to help us solve the unsheltered crisis? And it sounds to me like it provides more opportunities for tenancy. So more opportunities for people to be funded into housing. And for a certain segment of the population who is unsheltered, that may become a very reasonable placement to move them out of being unsheltered and get them resheltered and stable and moving forward. That's sort of the way I look at these, but it may not be our job to be the agency's job to be the one that's essentially, I don't know whether it would be in a contract with Medicaid or how that would go. But if this money is available and helps solve a problem, we should explain how that's going to be done. And maybe at a later date, we make the decision who's the agency that holds the money and provides the resource.
John, I think the idea would be that we would help support, if this is a viable approach, we would help support individual service providers in becoming Medicaid billing providers. And so they could charge for the services they provide, including not just like once somebody is housed, but like the helping somebody get into housing, that kind of case management piece.
Yeah, I think that I think you're asking the question that we need to ask of everything in the RHA, which is, how does this help us bring more people inside? And once we've done that, how does it help us keep people inside? And I think the specific answer, what Sima just said, is that FCS would allow these service providers to get a portion of their cost reimbursed by somebody other than the RHA, specifically the Medicare, which would reduce the per unit cost for us to provide permanent supportive housing services, which would then allow us to provide more people with permanent supportive housing services. So it's really around that keeping people housed portion of our mission, people that are at risk of homelessness. But anyway, I could just close this conversation by saying I agree with what Sima said, and I agree with how Alexis framed this as this is just an initiative that we have to go and do. One of many things we have to go and do.
Okay. Other questions or comments from board members?
Juanita,
I just saw you come on, of course.
What provider helps with that? Do you know, like, who's doing that work now and accessing these support services?
Like most of the PSH vendors are PHS service providers are looking into it. I was meeting with Lehigh, and they said that they have, I think, as many as 80 people who are currently using it.
Yeah, and I really would love to see more Indigenous communities being able to get the training, because I don't think there's a lot of people that are even aware of it and having that knowledge and how to go about that. I mean, even like diversion, right? Because people have to get trained in that to be able to learn more about it and how it all works. So it, like you said, we can just spread it around the work. And, Father Pat always said, help carry the work, and I think when everybody works together, being unified and ending homelessness and saving lives, I think more people are willing to learn and work together. So I hope there would be more opportunity to engage with RHA and building partnership with RHA and being able to get the training needed, whether it's diversion or however. I know you guys did the meetings online with different providers during the pandemic. So I was wondering if there was still communication and with your providers for collab with all these different types of emergency housing or whatever services, whether it's mental health, and are they even collaborating in those conversations, especially the mental health, right? And so that I would be interested in learning more about that. Thank you so much for this conversation. Is very critical, and I appreciate everyone's input and being able to listen to each other, learn more, because it really does help to gain more knowledge and have that wisdom to implement, you know, all these values, core values that RHA is about, and the theory of change, and being able to make sure people don't fall through the cracks like I did. That's all.
Good. Any others? It's 4 o'clock. We can still take some time on this, but I think we're also going to be talking about timelines of when the draft will be out and when we can see things. So any other, and I should ask, Alexis, do you have any more slides that you want to go over on this portion?
No, that about covers it.
Okay. Okay, any other? Yeah, who's?
Oh, it's Ben. Alexis, can you just go through in detail the plan for the finalization of the draft and when it will get if and when it will get previewed with some of our key stakeholders, including the funders, and then when it will get released to the public?
That is our next discussion item, exactly. Yes.
Okay, great.
Perfect, framed up. Exactly. Thanks. All right, Alexis, do you want to keep going on that? I think that's the big one of the big questions here.
Absolutely. Thank you. So part of the reason my slides are so ugly today has been all of our drafting. All of the energy is really going towards trying to get this draft adjusted. And I really should say revised version out the door as soon as possible over to a copy editor so we can start really talking to folks about it. So appreciate everyone's patience as we're working to try and pull that together so we can continue the conversation with key partners. And so you all have a meeting next Thursday, which I do want to ask the chair if we can have a conversation about, you know, how you would all like to use that meeting. There's the implementation board meeting for the 10th. Pardon me, I think I might have actually captured that wrong. Apologies. That is the 12th. The 12th. So I'll need to give a correction to that slide. At your implementation board meeting of the full body, there will be the agenda items related to the 5-year plan should include just conversation, a report out from this subcommittee, and a presentation on the nature of the plan, the structure, some of the key changes between the plans. And in your packet, you'll be receiving a memo that details the changes and what the plan will look like. Shortly following that, within the governing committee materials, which do come out the following day on the 13th, we're anticipating being able to have a revised version of the plan included in that packet. So the timing's a little crunchy on this. So being mindful that we want to be able to deliver some content within your board packet, but having adequate time to review back from the copy editor. So there'll be a draft available immediately following your meeting. And I can still maintain this weekly space to be able to evaluate, discuss that revised version as it rolls out. So really, we're looking at a revised version coming out on the 13th, with then on the 20th, there's the governing committee meeting where they would be discussing the revised version and some of the nature of changes. And then we also have another session of this subcommittee that then leaves the 27th and the 4th of May for system planning subcommittee sessions, with then the board's May meeting on the 10th slated as a potential vote of the plan, with then a governing committee meeting scheduled for the 1st of June. that is a rough look at some next key milestones here. But I think the main takeaway for everybody is that we're aiming to get a revised version out on the 13th, but trying to make sure that there's some comprehensive material to be included in the board packet, and again, supporting a discussion in time for your meeting on the 12th.
Okay. I've got to ask a quick question here about this so that I understand it. That means that on the 12th, when we hold our meeting, the adjusted draft will not have been published. It'll be published the next day as part of the agenda for the upcoming governing board.
Yes.
Okay. So, and Simha, you may be able to help here. What will we be going over on the plan at the meeting of the 12th? Will we?
Sorry, John, which 12th meeting are you referring to?
Well, it's actually that it says 410, but it's actually the implementation board meeting is on the 12th, April 12th.
Okay, and we also have our offsite on the 14th.
14th, yeah.
Right. So.
You know, I think we plan to schedule time during the 12th meeting to have a discussion about the fact, like we were going to have, I think, a discussion about budgets, or like a budget updates, a discussion around the 5-year plan. I can't remember what else was on the planned agenda. I guess the question would really, oh, sorry, go ahead.
I was going to just share bylaws.
Yes.
Also on the agenda.
Right. I guess the question would be, you know, it sounds like you want to make sure that there's a really solid draft before it's released to, or like, you know, public. What are the kinds of materials you'd like to release? What are the kinds of materials we could review ahead of that meeting that would allow for a substantive discussion? And would that then affect the, and like if in our discussion we have like a lot of feedback, right? What does that mean for the following day? You know what I mean?
Absolutely. So what we're trying to marry is just also the requirement that we need to have a board packet ready a week ahead of your meeting. So on the 5th is when you'll be getting materials, and we're still working with a timeline to be working with a copy editor during that time to really be sprucing up and getting the document in shape. But we wanted to provide materials in that transmittal that speak to the policy nature and so on. So having a memo that really details, I think the big thing here is those tables that speak to prioritization and funding and so on. And so trying to get a comprehensive memo that speaks to, your activities for years 1, 1 and 2, and then 3 and 5, and then that final table around like go for strategies for new funding. So that being a part of the conversation.
Okay. So the big like decision stuff, like what are you going to spend your money on, et cetera, like those tables, like we will have that. Okay.
We'll have that when? I'm sorry. I just want to make sure I'm tracking. Because I'm thinking we're not going to have that a week out from the April 12th meeting.
We will. That's going to be included, or that is to be included in your packet, but in memo format as we are continuing to revise and refine the draft full plan, but wanting to put some of those key policy pieces in front of you. And again, want to be clear, it's a matter of, we want to make sure that the document rollout is clear. It's been copy edited, it's in good shape, but wanting to bring forward some solid pieces for discussion for your board meeting.
Okay.
So having that supplemental memo, which is really akin to, from a content perspective, should be the same, but from, different format.
Other comments from board members?
Yeah, I feel like the next, can you guys hear me? I can't see if I'm muted or not.
Yeah, you're good.
Okay. The next time we release a draft plan, I think, we need to make sure that everybody's really comfortable with it, especially the people, especially the funders. So I would just ask Alexis that you guys are really making sure that you're getting to the staff in the city and the county and making sure that they're fully across this and they've got a chance to really review it before we publish things publicly again, because when we publish things publicly, there's a ton of effort that goes into reviewing it by the community. I mean, you know just how engaged everybody has been in this, and if I think this is an ambitious timeline, given that we're now like almost in April. I personally would be fine if this slips, but if we're getting the input that we need, and we make sure that when we release something, everybody is on board with it. Not that I want to drag this out. It's just that I love these meetings so much. I don't want them to end.
I'm fairly comfortable with this. I had expected something a little bit different, but I'm fairly comfortable. What we are saying here is there will be again, if these things flow, there will be a governing committee special meeting on June 1 to adopt the plan or not adopt the plan. Is that right, Alexis?
Correct.
Okay. So again, bringing up public comment, the meeting of the 10th of May, and I am assuming that's our regular meeting that month. We're going to probably have a lot of people who want to comment on the plan. I mean, we could take, I may be wrong, maybe not, but is that going to take an hour of public comment time? Have you given some thought about that?
That is unfortunate. I would defer to our clerk and our other board chair. I'm not as involved in agenda setting, I'm afraid. It's not fully my role,
Okay.
but I'll always take as much time as possible. But I don't get to be the decision maker on that one.
Okay. Austin, have you had a chance to think through all of this?
Yes, we've been having very active conversations around these and dates and fun stuff. I'm going to be releasing an email after this meeting to all IB members regarding the agenda, announcing it to you all and doing a attendance check as well.
Okay. I think that for that meeting of the 10th of May, you all are going to have to give some thought to how much testimony we will be able to take. I agree that people have to have a chance to see this. I agree that people have to have a chance to comment on this, but I also agree that we have to have the ability to make a decision. And that often takes a significant amount of time when it is something this important. So I would just ask, if we have 50 people signed up, should we drop it to 45 seconds of comment? These are, and that's things that, for those of us who've worked with the state legislature, that happens a lot. They get a lot of people signed up, especially during the COVID timeframe. And you go from your normal 2 minutes to 30 seconds. So it's not unheard of, but we've got to people have to have the ability to provide comment. And I assume we will be getting comment from service providers and cities and others via email. Juanita, you came back on screen. Did you have something you wanted to share?
No, I just put a question in the chat box. Do you want me to ask?
Oh, Juanita,
Yeah,
I don't know. Oh, sorry. Go ahead.
Yeah, go ahead.
I was gonna say, I don't know the answer to that, Juanita.
Okay, whoever might know, I guess you can just email me. I just want to say to create an opportunity for more engagement and collaborating nationally. And it's always good to be in those spaces where training, expertise, leadership, etc., everyone to learn from each other. And I say that because when I was at this last conference at the Alliance, and it was only because I got a scholarship, I saw Mark there, and there was 2 LEC members, but I finally got to go, and I was so happy and I was so grateful because it really showed me like the big picture of things and how organizing, collaborating, and they really lifted up people with lived experience. And I just really felt like I was valued and, and bring something to the tables and to help in that process and to help create change for everyone. And just the word organizing, it really gave me hope and really inspired me to hear other people what they were doing in their organizations. So I just wanted to make sure maybe people on the IB can have that opportunity as well to just cultivate, co-create together and build more leadership developments. And I find it very helpful. And I hope that one day we can have these things too. And I've heard a lot of people compliment our area that we were leading. And I thought, really? And it was just a good feeling that someone else made a comment like that, that recognized the value of the work that people were doing in our region. But anyway, that's enough out of me. That was just a
Yeah, and Juanita, I will forward that up the chain, and then I'll be in contact with you with what I find out regarding that.
thank you.
Oh, sorry, I got distracted by something on the other screen here. Okay, who else, anybody else want to weigh in here on this? And Alexis, do you have more? I do know let's talk about whether we need the meeting next week on Thursday. That is one topic I want to talk about, but do you have anything else that you wanted to go over here?
Yep, I just wanted to walk through those key milestones and get
Okay.
feedback. So I definitely received the comment from board member Merritt's. We'll make sure we're coordinating with staff so that there is read in and understanding of what's rolling out. We definitely want to move in partnership.
Okay. Yeah. So I have a conflict next Thursday. I'd probably have a hard stop by 4 p.m. But I think that there's sort of staff capacity, and there is and getting the final report and getting all of these documents done versus our time to go ahead and meet. I am of a mind that we should maybe pass on next Thursday, give staff that time to really work on things rather than be caretakers of us, which they do extremely well, and then have some sort of short written report that goes to the all board members, all of the IB, and maybe even possibly the governing committee, that just kind of lays out whether, I can't remember if it's 6 or 7 meetings that we've covered, and some of the some of the results from those meetings. I think it would be good in a short form, to like a memo form, to be able to go to them. Any other people's thoughts on this?
John, if I may just sort of think out loud, I think that's very reasonable. We have our scheduled meeting on the 12th. Mm-hmm. I think Austin will be checking in with, well, unfortunately, I'm not going to be able to attend. I think there's at least one or another board member who won't be able to attend either.
On the 12th?
On the 12th.
Okay.
Yeah. That's our regular scheduled implementation board meeting.
Right.
We should probably, I'm just sort of thinking out loud. One possibility would be if we don't have if the draft comes out like that day or the following day, would it make more sense to have cancel that meeting and have a special meeting like a week later? So I know we can't make that decision right here in this room together, but curious, Ben or John, do you have any thoughts on that? It would allow us to actually see the full draft, potentially. John, I think you're on mute.
Don't have enough screens anymore. So I think if I'm understanding this, we're not really going to see the full document until April 13th.
We'll have the meat of it by the 5th, it sounds like.
Okay.
We just won't have the colorful graphics and copy editing.
Okay. And so what you are, well, you know, I can't understand anything unless it has colorful graphics. So
I think I
so
was being
what,
selfish because I'm not going to be there on the 12th. I was wondering,
yeah.
well,
So
should we
you're
wait till we
asking,
have the final
should we do a meeting on, should we do a meeting on the 13th? Because that would be a normal meeting day. Is that what you're asking? Or should we do it, should we continue and just go with our normal meeting on the 6th?
Let's
I
stick to our plan, I think. Let's stick to what we're doing already, and just I think your plan of holding off on next week is reasonable, at least from my end. Ben, I don't know what your thoughts are. And keeping our regularly scheduled implementation board meeting.
I have no thoughts.
What's that? I'm sorry, Ben.
I have no thoughts on this.
No thoughts. Okay, Juanita.
Sweden's still here.
I'm
Yeah, she's-
flexible.
Okay. I think for the public and for everybody else, we should probably stick to our schedule stuff. I don't want to, make any big changes.
Well, it would really be just not having that meeting on the 6th. And we still
Great.
have, even though they're not on our calendar, we've established a regular meeting date, which we could then meet on the 13th if people are available. I also want to be mindful of not jumping on top of the governing board. I actually, as I was looking at that, I was kind of liking the fact that it'll come up in the governing board packet. And I think that helps the governing board set the tone for how much acceptance there is, or if there are areas where it's in agreement and areas where maybe there needs to be some perfecting. And we could then play a role after we've heard from the governing board on that, because ultimately it's the governing board's decision. So I'd like to suggest dropping the 6th and scheduling, or is the 13th the same day as the governing board?
The 13th is the day the packet would be going out
Okay.
to the governing board. And we could, I think there's a matter of, we only have, these sessions scheduled right now on your calendars, I think, until next week. So I think there's also a matter on the table of continuing these system planning committee meetings until the full vote of the governing committee as well. In which case you all would have a meeting on the 13th from 3 to 5, where you would have a draft document to look at.
Yeah, I actually kind of like that. And we would have the follow-up discussion from the following day or from the previous day. Okay.
Yeah, I do want to be, I think that's a better way to go. I don't think that, if it's publishing on the 13th, that we're going to be able to weigh in and go through everything, but we will have had an opportunity for the meeting that's due on the 12th to kind of go through some of the really the dollars and cents and the strategies. I think that will be really helpful. So I'm going to suggest we skip next week and we restart. Maybe you get those meeting notes out or meeting notices out for the 13th, the 20th, and then the 27th. And possibly May 4. I don't have everything up in front of me here, but does that, let me just ask staff. Can you work with that? That's a thumbs up. Okay.
yeah, we can get those notices out as soon as possible. Thanks in advance, Austin.
Okay, anything else that we need to cover today?
Not from a staff perspective, but would open the floor if there's any other key considerations from board members at this juncture, something you were hoping to discuss that hasn't been touched on yet. I'm definitely open to receiving that.
Alexis, just a question in the chat from our partner, George Scarola, about whether there'll be changes between when the plan is released and when the final plan is approved.
I think that depends on how our board is weigh in. So hard to forecast now. I imagine seeing a revised version will likely elicit some changes. So I think it'd be fair to assess that there would be some tweaks and adjustments. But with any hope, we've hit a place where we've addressed a lot of the major substantive changes, and there might be some reordering of maybe how things might be prioritized in between now and then. But that's my squishy answer to that question.
Yep.
Okay. Any other thoughts? Okay. Great. Is anything else that we need to talk about as the implementation board committee today or subcommittee? I am not seeing any more discussion that's needed. We'll take another half hour back and then get 2 hours back in our lives next Thursday. And that'll allow us to get in reading the plan and getting some things done. So thank you all for the participation. Staff, thank you for the great job and getting us prepared. And if there's no objection to adjournment, which I'm not hearing any, I'll adjourn the meeting. Okay, everyone have a great rest of the afternoon. Appreciate it.